Welcome to the Advanced Care Planning for People with Dementia webinar. In this webinar, we will discuss the nuances of advanced care planning for people with this disease. Your speakers today will be myself, Dr. Ana Maria Izquierdo Porrera, the Executive Director of Care for Your Health, and Sarah Hofstadter, Lead Project Coordinator for Voice Your Choice. This webinar is made possible through a partnership from Voice Your Choice Project and Care for Your Health. Care for Your Health is a Maryland nonprofit organization. Our main objective is to support individuals that choose to age and die in their homes and their communities. Most people need to make changes, adapt, and seek help in order to stay home. Care for Your Health is there to help them. Our mission is to provide multicultural care to elders, promote aging in place, support life changes, and enhance enjoyment. And our vision is to become an innovative leader in multicultural elder care that empowers patients, caregivers, and communities to live enjoyable, vital lives. So let's begin. What is advanced care planning? Advanced care planning, and you may know it as advanced directives or living will, is the process that addresses the medical needs in crisis situations or at the end of your life. Advanced care planning is making choices about the care you want to receive if you were unable to speak for yourself. These decisions are based on your personal values and preferences, as well as discussions with people that matter most to you, including your personal supports and loved ones, doctors, and other providers. So why are advanced care plans important for people with dementia? Well, advanced care plans serve as a way to protect your autonomy and ability to direct self-care, so you can have a say in your care and make sure your life is meaningful even when you cannot speak for yourself. Those who matter most to you will not have to guess what kind of care you want, and that is a gift that you're giving them. Your providers and those closest to you will know your values and wishes and can be better advocates for you. Now we are going to go at the different elements of advanced care planning and capacity through the different stages of dementia. So dementia has 7 stages. In stage number 1, there's no clear impairment, although you may have been diagnosed through the specific testing that is done to detect this disease. This time is the perfect moment for you to think through what you want for your care, not only today, but down the road when your disease progresses. In stage 2, you have very mild decline, and you may notice little changes in behavior or little impairments, but you're still independent. If you have not thought through what you want, this again is a good time to make those decisions and start having those discussions with your family and make sure they know what your wishes are and that your wishes are written down. In phase number 3, you will experience a mild decline. Your loved ones will start to notice more changes in your thinking and your reasoning. You may have trouble making plans, and you may repeat yourself a lot. You may also have a hard time remembering recent events. During this phase, you may get a better understanding what's coming down the road, and you may be able to tweak some of your decisions. As you progress, you'll go into stage 4, or moderate decline. At this stage, you will have problems with making plans and remembering recent events. You will have a hard time in activities such as planning, traveling, and handling money. It will be hard for you to make comprehensive decisions at this stage, but you can still share your feelings about things that are important in your life. Stage 5 is the moderately severe decline. You may not remember phone numbers or the names of your loved ones. You may be confused about the time of day or the day of the week. At this point, you may need assistance with some basic functions, such as picking your clothes or taking a shower. In terms of advanced care planning, at this stage, you can express what makes you comfortable or uncomfortable. But again, you will not be able to have a comprehensive conversation about your wishes unless this has been an important aspect of your relationship with your family and this conversation is not new to you. In stage 6, you will experience a severe decline, and that is expressed by forgetting the name of your significant other or needing help going to the restroom and eating. You may also experience changes with your personality and your emotions. At this stage, your loved ones will have to rely on nonverbal communication as much as verbal. You may be able to express some level of comfort, but not in a comprehensive way. And finally, stage 7, you will experience very severe decline. You will no longer be able to speak your thoughts. You won't be able to walk, and you will spend most of your day in bed. At this stage, you will have to rely on others to carry out your wishes. So what special considerations are there when discussing advanced care planning if you have dementia? One, be aware that you cannot foresee every possible care need that you will have in the future. You may think about, do you want to go to the hospital or not? But will you need this test or the other? Or will you require an ICU and then a comprehensive test? That's impossible to plan for. But what you can make sure is that you can share what makes you happy. What things are meaningful in your life. For instance, let's say you like to spend some time in the garden, or you like to spend some time playing with your kids. Your loved ones can then go to the provider and say, if we do those things that you are suggesting, will my loved one be able to be in the garden? Or will they be able to enjoy playing with their grandkids? If the answer is no, then you may not want to do those things. It is important to have a very specific discussion around eating, feeding, and nutrition, since this will be an issue at the end of your life. Whether you want artificial means of feeding or not has to be very explicitly discussed. Finally, you want to make sure you specify your wishes around personal care, since this will be an issue for you. Do you want to be cared for by a loved one only? Or do you not want to burden your loved one with things like soiling and incontinence? Those things that are about your personal care are going to be issues for you. So please make sure you're specific in stating your wants and needs. So now you've had all these discussions, you actually have it in writing, and hopefully you'll have it online after Sarah walks us through all of it. So why? Why did you do it? Does it have any benefit to you? And the answer is yes, it does. First, it helps you ensure that you receive the care that is consistent with your preferences. Second, it increases the probability that you can die in your preferred place, such as home. Or some people don't want to die home, they want to die in a hospital, or they don't want to burden their family and they want to go to a nursing home. It will happen, as you say, if you have been able to express it and share it with your loved ones. Third, it reduces the decision burden in those closest to you. And I cannot overstate what gift this is for your loved ones. Because when you're in the middle of losing someone that's very close to you, you don't want to have doubts of whether you're doing the right thing. The right thing is honoring your wishes, and you are giving them that gift. It also improves end-of-life care by allowing you to express your preferences before your cognitive function deteriorates to a point where you can no longer do that. And finally, it improves your outcomes and experiences, as well as has the potential to reduce your out-of-pocket expenses at the end of life. So now you have it, you've done it, you have it in writing. Why would you want to do it online? So first of all, think about yourself and your family in a crisis. You know, you have to go to the hospital, or you collapsed, or do you think the first thing you'll think of, oh, where is that document that we wrote? I put it there in an envelope. It's not going to happen. A lot of times in the middle of the crisis, you don't remember. By uploading this online, you don't need to think about those things. It will be accessible to your providers when you need it. It is also mobile across sites. So if you first go to the hospital and then go to a rehab center and then end up in a nursing home and then go back home, this will have access all around those sites. Also, the online function that Sarah is going to share with us is integrated with the health exchange in Maryland. And all providers will have access to it with your consent. Finally, you can make changes to that advanced care plan at any time, and it will be saved and updated according to your wishes. Let's move to the next step. So now you have described your wishes, you have put them in writing, you've uploaded them online. Now, what happens when you cannot talk? Who is going to make sure that those wishes happen? And that is the healthcare agent. So the healthcare agent is someone who knows you, knows your wishes, and can share them with providers and advocate for you when you cannot speak for yourself. That person can be a spouse, a cousin, a family member, a friend, a coworker, someone you've known for years. It's really about finding someone that can advocate for you. In Maryland, they need to be at least 18 years of age. And they cannot be your doctor because there is a conflict of interest. That doesn't mean that it's not important for you to share these advanced directives with your doctor, but they cannot be your healthcare agent. So how do you select a healthcare agent? Well, you probably want to select a primary healthcare agent, a secondary, just in case one is not able to be there for you, to speak for you. You have the second one. You may want to separate your somatic health, medical health issues from your mental health issues, although that's not necessary. You know, sometimes it's okay to have just that one person that talks for you when you need it. You want to make sure that they know and understand your wishes in any circumstance. And just bear in mind that just because you're married doesn't mean that that person needs to be your spouse. You know, some spouses are reluctant to take that role if they don't feel comfortable on it. So you may choose a child or you may choose a friend. You know, so long as everybody's in the same page, you don't need to choose your spouse if that is not the best person to represent your wishes when you cannot talk. So what questions should you ask to your potential healthcare agent before choosing them and before them agreeing to take that role for you? First, are you willing to talk to doctors and understand the care I need? So it is hard to make a decision if you don't understand what's at stake, right? So your healthcare agent needs to be someone that goes, has the meetings, understands the situation, and then can convey it to everybody else, can make sure that when the decision is made, it's compatible with what your wishes have been expressed to be. So that sort of willingness to interact with all your providers is going to be important. The second question is, if I'm still sick or unable to speak for myself, are you going to be able to make decisions based on my wishes? So a healthcare agent is not there to decide what they think is best in these circumstances. The healthcare agent is there to see that your wishes happen. Okay, so if you talk to someone and they say, no, I think this is what needs to happen, and you say, well, that's not what I wish is this other thing, and they still say, no, I think this is what needs to happen, they may not be your best option for a healthcare agent. The other thing you need to discuss is, do you understand my condition? Now, does it need to be an expert level understanding? No. Do they have to have years of experience in dementia? No. But they need to understand that who you are today is not going to be who you are down the road, and they need to be comfortable with all this progress. Now I am going to introduce again Sarah Hofstetter, and she will walk you through how to use the Voice Your Choice tools and allow you to have an online advanced care plan.
Thank you, Dr. Izquierdo Ferreira, for sharing that information. My name is Sarah Hofstetter, and I'm the lead project coordinator for the Voice Your Choice program. I'm going to show you how to complete an online advanced care plan so it's more accessible in emergency, or if you already have an existing advanced care plan, show you how to upload it so that you can make sure, again, it's more available, easily more available in an emergency, and that is portable across sites of care. First, I'd like to introduce you to the Voice Your Choice program. Voice Your Choice is a community-based advanced care planning program that encourages advanced care planning through providing education, as well as sharing information with both the community and healthcare providers. Voice Your Choice reaches out to all adults 18 years and older, not just individuals 65 years and older, to support them in thinking about and documenting their healthcare wishes. As we've seen during COVID, it's important that everybody has an advanced care plan because illness or accidents can happen at any age, and we want you to be prepared. One of the main goals of the program is to assist individuals in choosing and writing down who would speak for them if they cannot speak for themselves during a medical emergency. And as mentioned earlier, this person is called a healthcare agent. One of the most exciting features of the Voice Your Choice program is access to the free online platform that allows you to create an advanced care plan or upload, as I mentioned, an existing paper advanced care plan so that your plan is more accessible in an emergency and mobile across the different sites of care. And this is because Voice Your Choice, as mentioned earlier, is integrated with Maryland's Health Information Exchange system called CRISP. And CRISP allows healthcare providers to be able to access information about new patients who are coming into the emergency room or new patients in primary care or specialty care before treating them. And all of Voice Your Choice resources and tools are free thanks to the generosity of the Nexus Montgomery Regional Partnership. So first, a disclaimer, Voice Your Choice will not be offering any medical or legal advice during this webinar, and we will not be responsible for any technical malfunctions that happen either on the website or on the platform. And we cannot guarantee that your provider will access and follow your advanced care plan. So now that we've gotten that out of the way, let's learn more about online advanced care planning. The free online platform can be accessed through the Voice Your Choice website, and you see it here at the top, voiceyourchoice.org. While on the website, I'll point out the resources tab that can be useful for you in completing your advanced care plan or uploading an advanced care plan. You notice at the top right-hand corner here, we have a green button that says complete your advanced care plan. And that's where I'm going to go shortly to visit the free online platform. But before you can complete your online advanced care plan, you're going to need to create a personal account. So when you click on the button from the website, this is what you'll see on the online platform. And you'll need to click here, New User. When you click New User, you'll be asked for your contact information and to create a username. Do not use any nicknames and be sure to use your personal email, not your work email. This will be the email that your documents will be available through. And if you have any updates, this will be the email that will be sending reminders to you about the updates. A confirmation email will be sent to you once you fill that out. And you'll see there's a continue button here. When you click on the continue button, you're going to be brought in and you're going to be asked to create a password and a username. So remember to create a password that's easy to remember. We have so many passwords these days, but a password that will also protect your account. And then next time you come in, you're going to come in as a returning user. Once you log into the site, you will see this identification page. Be sure to fill out all the information on the identification page. Again, no nicknames, and be sure to use your personal email address, not your work email address. The information here will be used by medical workers to confirm that they have the correct medical information and that it's for you. This is particularly important when you have a name that may be common, such as Smith or Gomez. So now let's go ahead and visit the Voice Your Choice website. So I'm going to be going directly to the Voice Your Choice website. Again, it's at www.voiceyourchoice.org. So I want to go ahead and I'm going to show you the resources tab that we have here. You'll see we have a number of languages that resources are available in English, Spanish, Chinese, French, Vietnamese, Russian, and Korean. We're going to come into the English. So when you come into the English, you'll see that we have resources down here. We have advanced care planning webinars and guides, like the webinar that you're visiting today. We have some specialized webinars for different communities, and we have guides that can take you through step-by-step creating your online advanced care plan or uploading an existing paper advanced care plan. We also have a number of resources, such as how to choose a healthcare agent that goes into a little bit more detail. And then we have a document here called an advanced care plan versus Maryland MOLST, which is a portable medical order. And that can help you understand the difference between the two different documents. We also have a number of questions that are frequently asked, and we have the answers down below the questions. So now that we've had a chance to see the resources, I'm going to go ahead and click on the Complete Your Advanced Care Plan. So you'll see that we're on the platform, and I'm going to come in as a returning user because I've already created an account. So again, you'll be putting in your username and you'll put in your password, and then you'll click Sign In. And where we're going to land is something called the dashboard. And the dashboard provides you an overview of your account, how much has been completed, any documents that you have uploaded, etc. Where we're going to be today is under this tab called My Decisions. The My Decisions tab is where you would create an online advanced care plan. And then if you had an advanced care plan already, you would use the Add Documents button to go ahead and upload your existing advanced care plan. So let's start here at the My Decisions tab. We're going to first go to My Healthcare Agent. And we want to make sure that that gets documented and uploaded first in case there's a crisis that you have a person that's designated to speak for you if you can't speak for yourself. Now, when you fill this information out, what you'll see is that within 24 hours, that information is available to that Maryland Health Information Exchange System called CRISP. Once you've filled this out, and again, make sure you fill it out completely, this will be the information that the healthcare provider will use to contact your healthcare agent. You can go ahead and move on to My Advanced Care Goals. My Advanced Care Goals is where you're going to go to document your preferences and your values around healthcare treatment. So you'll see we've checked a few things. You can add another piece by just clicking here. And then when you come to the button here, you can move that up or down depending on your priority. We're going to see what this looks like when it's all printed out. And you'll see that this is listed in priority order. Throughout the platform, you're going to see these guides. These guides provide a glossary for words that may not be familiar to you, as well as questions that you may want to ask in response to that page. What you'll also see is there are boxes down below. So if there's something that you want to document and it's not here available in one of the pre-selected options, you can go ahead and fill that out, and that will further personalize your answers. You'll see here there's a section that you can talk about your religion, spirituality, or faith. And then also if you'd like to designate access to a palliative care team at the appropriate time. Next, we're going to move on to my preferences in certain circumstances. And this is the area where you're going to document your healthcare treatment preferences if you are unable to speak for yourself. Before you do that, we strongly encourage you to have a conversation with your healthcare provider and talk about what treatments would be best for you based on your health and your faith or spirituality. Again, you'll see the box here that you can fill in additional information if the options are not exactly what you're looking for. We're going to move on to a page called My End of Life Preferences. Under My End of Life Preferences, you can select where you want to spend your final days, as Dr. Izquierdo Pereira mentioned earlier in the webinar. You'll also have the opportunity to note if you have a portable medical order. In Maryland, that's called a MOST form, and it asks you about your thoughts on organ and tissue donation. And the final page we're going to look at is a page called My Thoughts. Under the My Thoughts tab, you have the opportunity to document things that are important to you that are not necessarily related to medical treatment. So for instance, you may like to have your bed facing the window because you like to have the sun on your face. You may like to have flowers in your room or the sound of the ocean. You can document these things here. And this is a really great place to start a conversation with your loved ones about advanced care planning and talk about, yes, if I'm unable to speak for myself and I'm agitated, put another blanket on me, I'm cold, or I would really appreciate having the sound of the ocean in my room if I'm unable to speak for myself. So we're going to go to a place called My Circle. The My Circle tab allows you to list your contacts, any contacts that you want to list, and you have an option to share information. That option is everything from what you see here, which is no access, to sharing all documents, and you have places in between. So you'll see we have the name and the email and then the relationship to us. And again, when you're filling out the information for your contacts, make sure that that information is as complete as possible. So next, we're going to go to the My Documents tab. I want to show you an interesting page called Document History. This is an extra layer of security. As you can see down here, this platform has already been certified by High Trust, and that's a very high certification for making sure that information is safe. In addition to that, there's something called the Document History. The Document History, as you can see, documents any changes that happen to your account, and then make sure that you can see what the changes are. So if there's ever a question in the future about something that got changed on your advanced care plan, people can go through and see what the history was. And this cannot be altered by either the user or by anybody else. So we've gone through, we've looked at all the tabs. So let's look at what this would look like once you've completely filled this out. We'll do a preview. So on the preview, you'll see your information is here. We have the healthcare agents, as well as your advanced care goals, again, in priority order, thoughts about religion, and your healthcare wishes for medical treatment. And then let's look and see what a healthcare provider would see. It's very short because, as you know, in emergencies, we want to keep things as concise as possible for the healthcare provider. But it has your information. Here we've indicated a healthcare provider, in this case, it's a cardiologist, your healthcare agent, your treatment goals, your thoughts. And then down here in the red box, this is where you have your preferences for your healthcare treatments. So I just want to go very quickly back to our dashboard. And I want to show you, if you already have an existing advanced care plan, how you would upload that. So you can click on this big green button here that says Add Documents, and you'll come to a page that gives you the opportunity to upload some documents. You want to make sure that you provide a name here, and also make sure that you select what kind of document it is. Most importantly, you're going to want to make sure that you document what date this is, because healthcare providers are going to be using this as indication of what is the most recent information for you around advanced care planning. So that was a very quick run through of the website and the platform. If you'd like to have additional information, as I showed you under the resources tab, we have webinars as well as a step-by-step guide that can help you walk through how to complete your online advanced care plan. So for more information, as I mentioned, feel free to visit voiceyourchoice.org. And if you'd like more information about Care for Your Health, please visit www.careforyourhealth.org. Thank you so much for joining us today. This is going to be the end of our webinar. I hope you found this information useful and you will complete your online medical advanced care plan or upload your existing paper advanced care plan. Thank you so much for your time.